Hi class, this is Dr. Shahada, and in this video I will be touching on some topics that are covered in Chapter 2 titled Beliefs, Values, and Health. So in this week's module you will have two files from Chapter 2. One is your PowerPoint presentation, which I will also be touching on a couple of slides in the presentation in this video. I'm not going to be going through all the slides since a lot of it is self-explanatory. Once you read the chapter, you review the slides, you should get a pretty good grasp of the topics addressed. Now, the second file is the terminology file, and this is where a lot of the terms used in Chapter 2 are defined. And I'll be going through some info from the chapter section that is found in this week's module, as well as slides in the PowerPoint presentation for Chapter 2. So let's get started. So this chapter, we're focusing on health as well as the area of public health. So the main objective with public health is ensuring that conditions promote optimal health for the society as a whole, to interact any threats that may jeopardize health and safety of the general population. Now, there's 5 core disciplines in the area of public health, and I'm going to briefly go through them in this table that you see. So the first one is biostatistics. Biostatistics is the application of statistical procedures, techniques, and methodology to identify health trends. So biostatistics is an integral part of public health as it forecasts scenarios, identifies health trends, and explains biological phenomena. Now, the area of biostatistics is actually used in the area of research with researchers found in the other areas of public health. So my specific area is health promotion and disease prevention. But of course, I have taken courses in biostatistics during my doctoral studies, and I use biostatistics with my research to be able to find which groups or specific lifestyle behaviors that may increase one's likelihood of an illness. Okay, so some examples of careers in the area of biostatistics: so survey statistician, health data analyst, research data coordinator, and biostatistician. Now I'm going to scroll to the second area here, environmental health sciences. So environmental health improves public health through identifying and addressing environmental risk factors. So such settings include air quality, food protection, radiation protection, solid waste management, and etc. Some examples of careers in this area include ecologists, environmental consultant, and oceanographer. The next area is the area of epidemiology, and this area takes into account various hereditary, behavioral, environmental, and healthcare factors. Epidemiology is the study and control of disease or injury patterns in human populations. A great movie to watch that touches on epidemiology and epidemiologists is a movie titled "And the Band Played On." It talks about the HIV epidemic and how it first came about in the early 1980s. It was actually coined as HIV in 1981 when the first cases were being found in California, and there was a team of medical doctors and epidemiologists from the Centers of Disease Control and Prevention that went out to meet the cases that were diagnosed. Of course, the term wasn't coined at that time. And you get to see how they start looking into the behaviors of the people, the cases that had this HIV or all these symptoms that they found that were associated with a number of different patients. and how they started mapping everyone they were in contact with. And it gives you an idea of how they were also able to figure out how this virus was spread. It's really just really a great movie that really will give you a clear idea of the job of an epidemiologist. So some of the careers in this field include communicable disease epidemiologists, which are, as I said in my example of and the band played on, were communicable disease epidemiologists. That was their specialty. And you get to see firsthand how they were able to warn people that were in contact sexually with these cases that had this unknown virus at the time before they coined it as HIV. And it's a great movie to watch. You could also be a public health officer or a health data analyst. All right, so let's go to the next one. Health Service Administration Management. So Health Services Administration combines politics, business, and science in managing human and fiscal resources needed to deliver effective public health services. So examples of careers in this field include Director of Strategic Planning, Medical Care Administrator, and Gerontology Coordinator. So Health Service Administration is also found in the area of public health. And last but not least is health promotion, or as I've been taught to call it, health promotion and disease prevention, which focuses on ways to encourage people to make healthy choices and includes the development of community-wide education programs that range from promoting healthy lifestyles in order to prevent disease and injury to research in complex health issues. So examples of careers in this field include health education, program coordinator, school health educator, and behavior scientists. All right, so now what I'm going to do is I'm going to switch over to the slides found for the slide presentation used for Chapter 2, and I'm going to be touching on health, the definitions of health regarding the medical model, as well as the definition by the World Health Organization. So I'm going to switch over, and then I'll be coming back to this page to talk about the epidemiology triangle a little later. All right, so let's do that. So now looking at the basic concepts of health, the medical model defines health as the absence of illness or disease. So within the framework of the medical model, health has been viewed as the absence of illness or disease. Alleviation of symptoms is often the goal of medical interventions. So the implication is that the health delivery system emphasizes diagnoses and treatment rather than prevention of disease. So with this type of framework, health promotion would not be considered a responsibility of the health delivery system. Okay, so when you think of medical model, remember that it defines what ill health is not. Okay, that's clearly it. Now, a person's ability to perform social roles and tasks is sometimes viewed as health. However, a person may be able to perform certain social tasks in spite of being sick. On the other hand, when there is a concern that a sick individual may infect others or make his or her condition worse, the individual is generally asked to stay home from work or school and seek medical attention. So that's a little about the medical model and how being able to perform social roles and tasks is sometimes viewed as health. Now, when we're looking at the World Health Organization, their definition that they proposed goes beyond the medical and social model in emphasizing a complete state of well-being. From the health delivery perspective, it advocates achieving a balance between physical, mental, and social aspects of life. Since the social aspects of health extend beyond the individual level. This definition implies that the healthcare delivery system would go beyond individual health and take responsibility for the health of entire communities and populations. So this definition includes the physical, mental, and social well-being components of health, not merely the absence of disease or illness. Now, the healthcare system, as defined by the World Health Organization, are all the activities whose primary purpose is to promote, restore, and maintain health. Now, the next definition of health takes a more holistic view. So holistic health is the well-being of every aspect of what makes a person whole and complete. Okay? So the holistic view of health adds a fourth dimension of spiritual well-being to the definition proposed by WHO, or the World Health Organization. A person's spirituality can have a positive impact on the individual's overall health. This dimension has become important in several areas of healthcare delivery, such as end-of-life care and long-term care. Caregivers need to recognize this aspect of health and respect the patient's religious and spiritual beliefs. The holistic approach to health also alludes to the need to incorporate alternative therapies into the predominant medical model. So the next slide here shows that healthcare services believed to improve a person's health and well-being. This is looking at it from a holistic perspective. And again, holistic medicine seeks to treat the individual as a whole person. So now I'm going to jump to the topic of risk factors. So here in slide number 11, what are risk factors? First, let's define what a risk factor is. So risk factors are attributes that increase the likelihood of developing a particular disease or negative health condition in the future. So it requires a broad approach. One useful explanation of disease occurrence is provided by the epidemiology triangle. So this triangle has the host, agent, and environment, and I'm going to be going into more detail regarding this model. And it is in the next slide here. So again, risk factors are the attributes that increase one's likelihood of developing a particular disease. There's a lot of different types of risk factors. Some types of risk factors include poverty, overcrowding, and malnutrition. So it are those attributes that increase one's likelihood of developing a disease or a negative health outcome. So here is the epidemiology triangle, which explains disease occurrence. I'm actually going to jump back to the information, some info from the chapter section in this week's module, because I feel like the diagram or the little triangle image is actually a clearer one. So let's jump there and I will continue explaining about the epidemiology triangle. All right, so here we are. I wanted to explain the epidemiology triangle through this specific diagram because it really provides examples for you and will help you understand what each component of this triangle is. So let's start with the host. Host is the person exposed to the agent and at risk of developing a disease. Okay? So when we're looking at a host, you are looking at the age, sex, race, genetic profile, level of immunity, fitness, personal behaviors. This is the host. Okay? The next component is the agent. can be biological, it can be chemical, physical, or nutritional. And this would include, there's the examples. If it's a biologic agent, it's bacteria and viruses. Chemicals, we're looking at poison, alcohol, smoke. Physical, we're looking at trauma, radiation. Fire are examples. And nutritional, lack or excess. Now, environment, it's the set of conditions that directly or indirectly are responsible for exposing the host to the agent. Okay? So we're looking at the temperature, humidity, altitude, crowding, housing, neighborhood, water, milk, food, radiation, pollution, noise. So everything has to be just right in order for this agent to be a threat to the host. Now, when we're looking at environment, temperature, humidity, altitude, we're looking at more of a biological substance. When we're looking at crowding, housing, neighborhood, it all applies depending on the type of agent we're talking about. Okay? So as I scroll further down, there are your examples. And then I also wanted to touch on the topic of epidemics, but since I know I touch on it a little here, but I'll go back to the slides for that one. So again, this epidemiologic triangle is just a model that scientists have developed for studying health problems, and it can help you guys understand infectious diseases and how they spread. We've already defined all three, but a better way to look at them is your agent is the what, host is the who, and environment is the where. Now I'm going to jump to the slides, back to the slides, before I come back and discuss primary, secondary, and tertiary prevention. In the slides, I just want to touch on what public health is again, the difference between medicine and public health, and then I just want to touch on the terms when we're looking at global health. So here we're looking at epidemics, endemic, pandemic. I want to just explain it in more detail. All right, so we're going to jump back to the slides. All right, so this is slide number 31. And here it's just touching on the topic of the mission of public health that's proposed by the Institute of Medicine, which defines it as society's interest in assuring conditions in which people can be healthy. Now, public health is the science of protecting and improving health of communities through education, promotion, healthy lifestyles, research for disease and injury prevention. Public health professionals, they analyze the effect of health of genetics, personal choices, and the environment in order to develop programs that protect the health of your family and community. So the aim is, the focus is to ensure the conditions that promote optimum health for the society as a whole, as I had mentioned earlier in this video. So this slide, if you just click here, it's like a hyperlink, and it'll talk to you, it's a video that explains a little more of the area of public health. And then I just wanted to show you here really quick the difference in perspectives when we're looking at the area of medicine versus public health. So medicine focuses more on the individual patient. It emphasizes on the biological causes of disease and developments and treatments and therapies. It also concentrates on treatment of the disease and recovery of health. So the focus here is first individual, and it's looking more on addressing the problem regarding the illness. So with public health, we're focusing on a more community-wide level, on a population level. It focuses on identifying the environmental, social, behavioral risk factors that causes disease, and on developing and implementing population-wide interventions to minimize those risks, to help prevent illness or the onset of illness. And it deals with various efforts to prevent disease and promote health. All right. And now I am going to jump to the topic of global health. And this is slide number 36. So as I mentioned a little earlier, these are 3 terms that are also defined in that little some information from the chapter section of this week's module. Let's look first at the topic of endemic. So endemic, where an illness is present in a community at all times, but in a relatively low frequency, typically restricted to a locality or region. So an example of this would be malaria, where it's a constant worry in the area of in Africa. Okay, so that is an example of what an endemic is. Now, looking at epidemic, we're looking at a sudden and severe outbreak within a region or group. So as with AIDS in Africa and intravenous drug use, these are examples of epidemics, especially HIV when it first came about, and then it switched over to more of a pandemic where it became more widespread. Another example of an epidemic would be in 2012. There was actually a meningitis epidemic in 23 states here in the US, and it killed about 36 people, and there was a total of about 500 cases. And it came about, again, within a specific region here in the US. 23 states were affected, and it was sudden and very severe. Now, when we're looking at pandemic, it occurs when an epidemic becomes widespread and affects a whole region, a continent, or the entire world. So we look at HIV and AIDS outbreak now is at a pandemic level. It's widespread throughout the world. And another example is the Spanish influenza. That was back in 1918, and it killed 40 to 50 million people, and it affected the whole world. Now, the next topic I'm going to be covering is the different types of prevention. All right, so this is also an area that's covered in this week's module, and it's also included in this PowerPoint presentation. So let me jump to those slides. All right, so there's 3 areas of prevention. We have primary prevention, which are activities that are undertaken to reduce the probability that a disease will develop in the future. The objective here is to restrain the development of a disease or negative health condition before it occurs. Secondary prevention is early detection and treatment. So we're not preventing the onset of the illness. It has already been contracted or it's already developed. Now the idea is detecting it early. The objective is to block the progression and or early detection of any disease. So this is where mammograms come in, highly active antiretroviral therapy, or HAART in relation to people with HIV, and that's what PLWH stands for. It's people living with HIV. Now, the third prevention is interventions that could prevent complications from chronic conditions and prevent further illness, injury, or disability. So examples of this would be rehabilitation therapy that can prevent permanent disability, infection control practices also are under tertiary prevention. So here also we touch on primary, secondary, and tertiary. Different examples are used. And this table especially, I really like it because it includes the different intervention levels. So you can see the differences between the primary, secondary, and tertiary types of prevention, as well as examples of them on the individual level as well as the population level. Below that are the definitions it goes in a little more detail. Be sure to take the time to read it. And then I want to touch on the force field and well-being paradigms of health. All right. And this is by Henrik L. Bloom. It was created in 1974. So this force field and well-being paradigm of health, or Bloom's model, points to 4 key determinants of health. We're looking at environment, right there, lifestyles, attributes and behaviors, so that we're looking at individual behaviors, and a person's genetic makeup, and medical care. So that's hereditary and medical care. These 4 elements are interactive. The 4 must be considered simultaneously when addressing the health status of individuals or populations. So the main implication of these health determinants is that the healthcare delivery system must go beyond the medical model in order to achieve optimum health. The environment encompasses physical, sociocultural, and socioeconomic dimensions. So an example of this would be the optimization of health would require war on poverty, better educational opportunities for all Americans, and better child care. Mainly costly diseases can be avoided by lifestyle changes, right? So when you include healthy diets, exercise, smoking cessation, and abstinence from drugs, these lifestyle changes can really help you avoid diseases. One of the problems with the healthcare delivery system is that the preponderance of healthcare expenditures are devoted to the treatment of medical conditions, such as heart disease, cancer, stroke, rather than to the prevention and control of factors that produce those medical conditions in the first place. So appropriate steps in addressing the key determinants of health can save money as well as needless suffering. Genetic factors often are used as an excuse for ill health. However, today's healthy lifestyles and behaviors are likely to influence health of future generations. So one key point that I mentioned here is if we address key determinants of health, we can save needless suffering. So I'm going to touch on what determinants of health are all about. I'm going to switch over back to the slides, and we're going to talk about that a little further, because this specific paradigm focuses on the major determinants of health, again, which include healthcare, genetics, environment, behavior, and lifestyle. All right, so we are back to the slides, and we are looking at the determinants of health. So here is a video which is also found in this week's module, and it just talks about Healthy People 2020, which are the objectives that we have on a national level to help make the U.S. healthier, okay? And they're the goals. Every 10 years, a new one is proposed. And this video will also touch on the determinants of health, and I especially want you to take the time to watch the TED Talk about the social determinants of health. It's very powerful, and it gives you a clear idea of what the determinants of health are, which they are the conditions in which people are born, grow, live, work, and age, including the health system. So the social part, your interactions with the external environment. These are your friends, family, places, and different systems. The determinants are the effectors or the indicators, something that's determined or influenced by. And ultimately, what's health? Health, we all know what health is, but we put it in the context of physical, social, spiritual, and mental. And when we were looking at this Bloom's model, it's taking all these different components and looking at it from a more holistic view. So factors that influence an individual and a population's health, as we said, genetic makeup, likelihood of cancer, diabetes, and heart condition are affected by your genetic makeup. Individual behaviors also impact your likelihood of getting a disease. Smoking, exercising will reduce that likelihood. Okay? Then we look at medical practice, yearly checkups, 10% effects, 10% of premature deaths. Social and environmental, 20% of premature deaths. So these are different components and how it impacts the likelihood of a negative health outcome, in this case, your mortality rate. Okay? And then this is the last slide that I want to touch on, and here are different examples of the social determinants of health. Okay? And all right, so that pretty much covers what I had wanted to touch on regarding chapter 2. I do need you to go through the whole chapter, meaning you read the whole chapter and go through all the PowerPoint slides presented to you. You are going to be allowed to use these PowerPoint presentations when you're taking exams in my class. So I always suggest for my students to compile all your PowerPoint presentations into, one PowerPoint presentation. At least the chapters that are assigned for what, if it's your midterm exam or final exam. And this way, you won't have to be opening all different files. You'll have everything already open for you to be able to view. I hope you found this video helpful. Of course, if there's anything that is covered in this chapter that you aren't sure about, be sure to let me know. And remember, even though I didn't go through, regarding chapter 2, the principles of market justice and social justice, it doesn't mean that it is not important. There were just different aspects of this chapter that I wanted to touch on. And I do need you to also make sure you go through everything very well. All right, so take care. And again, if you have any questions, be sure to let me know. Take care. Bye.